Well, hi, classmates. I decided to do acute stress disorder. I've always liked this disorder because it's so interesting how it's the phase right before post traumatic stress disorder. And if not caught in time, it can manifest into PTSD and really cause some issues. So that's what my presentation is going to be about. Hope you enjoy, and here we go. So acute stress disorder, also known as ASD, occurs within 4 weeks of the traumatic event. The symptoms must last for at least 2 days. And so, like I said, this disorder is interesting because it's just extreme stress to a traumatic event, lasting 2 to 4 days, of which diagnosis can be applied. Help can come to the individual, hopefully, and PTSD can be sideswiped. So the etiology, acute stress disorder, used to be referred to as shell shock in World War I, due to the reaction of soldiers exposed to exploding bombs or shells, of which resulted in concussions and blows to the central nervous system. The diagnosis of this disorder was originally intended to identify post-traumatic stress disorder in individuals. The symptoms for ASD mirrors those of PTSD, just yet for a shorter period of time, occurring right after a traumatic event. So stress is anything, when you think about stress, it's anything that challenges one's emotions and mental well-being and challenges coping resources and abilities as well. Stressors are the external demands, while stress itself is how the body reacts to these demands. An individual's personality and life experiences, such as optimism, increased self-esteem, and a history of a healthy mental state, are all components of which can aid in providing the ability to cope when a stressful situation arises and modifies intense reactions. So a traumatic event can be defined both medically and psychiatrically. Medically, trauma refers to a serious or critical bodily injury, wound, or shock, while in psychiatry, trauma refers to an experience emotionally painful, distressful, or shocking. Psychological trauma can be long-lasting and cause somatic symptoms as well. So the trauma-related stressors have key factors that make some events more stressful than others, such as the severity of the stressor, how long does the stressor last, the timing of the event in one's life, how closely the event affects a person. Is it direct or indirect? Whether the traumatic was expected or unexpected, and how controllable the event was. So diagnostic features. The DSM-5 states that ASD is diagnosed 2 to 5 days following exposure of one or more traumatic events. Symptoms must persist during the short time frame for a diagnosis to be made. The disorder is a result of exposure to actual or threatened death, serious injury, or sexual violence. According to the American Psychiatric Association. The victim may experience a traumatic stressor directly or indirectly through witnessing a threat against others or just to oneself. The symptoms for ASD vary by individual, however, typically mirror those of PTSD, serving as early warning signs that a severe mental disorders are lurking just around the corner. So according to the American Psychiatric Association, the symptoms to be aware are as follows. Re-experienced events are recollections or memories of the event, reliving the events as if they are in present time. The individual will have memories that are intrusive and include sensory, emotional, or physiological components such as shortness of breath after hearing fireworks during the 4th of July. So, they're triggered easily. They could be at a family function, and then all of a sudden a sound or maybe a gust of wind will completely set them off. And it could just be a reaction physically, such as, like I said, shortness of breath, or maybe a migraine, or a feeling of panic or terror, and they're not really even being threatened, but it does remind them of the event that happened. The absence of feeling happiness, they don't have joy or satisfaction. It's just a constant state of sadness, anger, guilt, or shame. And so treatment for ASD has proven to be, there's lots of different methods, but CBT, cognitive behavioral therapy, has proven to be a very powerful method. So statistics, so I looked into the Journal of Affective Disorders, and statistics state that between 19% and 33% of victims from violent crimes develop ASD, with up to 89% of them developing PTSD afterwards. And there is therefore a powerful risk factor in developing PTSD. Due to the reduction in quality of life associated with PTSD, it is crucial to provide early and effective therapy interventions, such as CBT. It is the counselor's duty to properly assess clients at the beginning and throughout treatment. The client's safety is detrimental and correlates with his or her environment, social and cultural elements. State of mind is heavily influenced by one's socioeconomic background, access to basic needs, and culture of which one belongs. The counselor must be knowledgeable of their client's experience in life. The client needs to be able to understand the individual for the person that they are, and the shoes that they have been walking in. Also, the therapist needs to be able to be be able to have a collaborative approach, basically. So you can't just use CBT. You need to be able to incorporate physical activities like trauma-based yoga, meditation, prayer, if that suits the client. Medication, pair up with a psychiatrist if necessary. If you're a counselor that is going to treat ASD or PTSD for that matter, you need a collaborative approach, and you need several different ways to kind of treat these symptoms. So the reason CBT is so successful is because it challenges irrational beliefs and thoughts and allows a safe place to process the fears. Psychoeducation is also another big piece of treating ASD. A lot of times after a traumatic event, these flashbacks and nightmares and all these things that are happening to the individual seem crazy. They seem out of control. And so if you provide psychoeducation and let them know that they are in fact reacting in a normal way, then they don't feel as crazy and they can work through it. Other forms of treatment include cognitive processing therapy, stress inoculation training, eye movement desensitization reprocessing, and trauma-focused cognitive behavioral therapy. So while assessment and professional counseling deem as the most effective method for recovering after a traumatic stressor, loved ones also have a huge part in, or they can have a huge part in preventing PTSD and for quicker healing. The victim just needs someone to listen, actively listen, be present, and non-judgmental. As long as the victim can get out, if they're willing to talk and they're able to get out the story and get out what has happened to them, then progress can be made with or without a professional. But of course, the most effective way is with a professional counselor. So that concludes my 10-minute presentation. And my quiz question to you is, what is the difference between acute stress disorder and post-traumatic disorder? All right, hope you enjoyed it.